In this presentation, we're going to talk about a few other foundational elements, such as the Cornerstones and Standards with public health nursing. We're also going to be comparing it to other nursing standards. Public health nursing cornerstones actually provide the foundation for population-based nursing practice. The cornerstones reflect the values and beliefs that guide public health nursing practice and are very closely related to ANA's principles of public health nursing, which we're going to discuss on another slide. The cornerstones that are reflected in public health nursing's daily practice occur when they organize their workload and schedule based on priority health needs of clients and the communities they work within. When they take time to establish trust when visiting families in their homes, trust is the number one thing that public health nurses need to do. It might take time to develop trust, and that's okay because health outcomes are better when the individual trusts us. Public health nurses carry out holistic assessments of the individual and their family, and they do so within the context of the culture, ethnicity, and the community that they live within. They use evidence-based practice from nursing and public health sciences to select appropriate and effective interventions. They also collaborate with other members of the healthcare team, and they make critical decisions about the needs of their clients and the selection, implementation, and evaluation of interventions based on their professional knowledge and professional licensure. This slide is a table or a comparison. On the left-hand side is the cornerstones of public health nursing, and this is compared against the American Nursing Association's principles of public health nursing practice. The cornerstone of public health nursing is that it focuses on entire populations, and ANA, the client or unit of care, is the population. A cornerstone of public health nursing is that it reflects community and priority needs. And with American Nursing Association, the primary obligation is to achieve the greatest good for the greatest number of people or the population as a whole. The cornerstone of public health nursing is that it is grounded in social justice, compassion, sensitivity, diversity, and respect for the entire person. ANA sees a public health nurse is obligated to actively identify and reach out to everyone who might benefit from a specific activity or a service. The cornerstone of public health nursing is that the nurses encompass mental, physical, social, spiritual, and environmental aspects of health, and that is related to the American Nursing Association's role of public health nursing that focuses on strategies that create healthy environments for populations so they can thrive. The cornerstone of public health nursing, where it promotes health through strategies driven by epidemiological evidence, and we'll talk about epidemiology later on in the course, is related to American Nursing Association's optimal use of available resources and creation of new evidence-based strategies. Collaboration within community resources to achieve strategies is related to the American Nursing Association's public health nurses' willingness to collaborate with the client as an equal partner. Public health nursing and holistic nursing practice actually have common roots. As we saw in the last presentation, Florence Nightingale and Lillian Wald were very concerned with vulnerable populations, looking at their environment and their social circumstances. They weren't just looking at the individual, but really trying to promote positive health outcomes by considering them within the context that they live, and also being their advocate. Both Nightingale's and Ward's nursing practices has actually influenced the contemporary holistic practice of public health nursing that we have today. The contemporary nursing theory that we have today for public health really emphasizes the curative factors of disease and illness and embraces the wholeness of the individual. It also looks to reflect on expansive sharing process that changes the self, others, and culture or the environment. All professional nurses, regardless of their clinical areas of practice or expertise, have a scope of practice. This refers to the boundaries of safe and ethical practice and is what is our sandbox or the guardrails of what we're allowed to operate in. A PHN, or a public health nurse's job description, is a good measure of the nurse's scope of practice. Professional nurses are actually also guided by standards of practice developed by their professional nursing organizations. One nationally accepted set of standards for public health nursing is the American Nurses Association publication, Public Health Nursing, Scope and Standards of Practice. The standards of practice for public health nursing includes assessment, which means the public health nurse collects comprehensive data pertinent to the health status of populations. Population diagnosis and priorities. The public health nurse analyzes the assessment data to determine the diagnosis or issues. Outcomes identification. The public health nurse identifies expected outcomes for a plan specific to the population or issues. Planning. The public health nurse develops a plan that prescribes strategies and alternatives to attain expected outcomes. Implementation. The public health nurse implements the identified plan. Coordination of care. The public health nurse coordinates care delivery. Health teaching and health promotion. The public health nurse employs multiple strategies to promote health and a safe environment. Consultation. The public health nurse provides consultation to influence the identified plan, enhance the abilities of others, and effect change. Regulatory activities. The public health nurse participates in application of public health laws, regulations, and policies. Evaluation. The public health nurse evaluates progress toward the attainment of outcomes. Ethics. The public health nurse practices ethically. Education. The public health nurse attains knowledge and competence that reflect current nursing practice. Evidence-based practice and research. The public health nurse integrates evidence and research findings into practice. Quality of practice. The public health nurse contributes to quality nursing practice. Communication. The public health nurse communicates effectively in a variety of formats in all areas of practice. Leadership. The public health nurse demonstrates leadership in a professional practice setting and the profession. Collaboration. The public health nurse collaborates with the population and others in the conduction of nursing practice. Professional practice evaluation. The public health nurse evaluates her or his own nursing practice in relation to professional practice standards and guidelines, relevant statutes, rules, and regulations. Resource utilization. The public health nurse utilizes appropriate resources to plan and provide nursing and public health services that are safe, effective, and financially responsible. Environmental health. The public health nurse practices in an environmentally safe, fair, and just manner. Advocacy. The public health nurse advocates for the protection of the health, safety, and rights of different populations. These are the references for this PowerPoint today. They may serve as an external resource for any of your assignments this week, or they can potentially provide more information on any of the topics that were covered in this PowerPoint.